So what's the difference between upper motor and lower motor neuron lesion?
Okay, first of all, the upper motor neurons are those neurons which are taking motor fibers in the descending tracts from the cerebral cortex towards the cranial nerves or the spinal nerves. For the cranial nerves, this tract is known as corticobulbar, while for the spinal nerves, it's known as the corticospinal. While on the other hand, the lower motor neurons are only the peripheral nerves which contain the 12 cranial nerves, 12 pairs of the cranial nerves and 31 pairs of the spinal nerves. They are known as the lower motor neurons. If they are damaged, then we'll say a lower motor neuron lesion, while if in the central nervous system the tract is damaged, we'll say it is as a upper motor neuron lesion.
Sir, how will we differentiate it in the case of facial nerve?
Okay, look, in the case of facial nerve, first we go to the lower motor neuron. It's very simple. If the lower motor neuron or the facial nerve is damaged of one side, all of the muscles of facial expressions on the same side of the face will be paralyzed straight away, upper half of the face as well as lower half. Well, when we talk about the upper motor neuron lesion in the case of facial nerve, only contralateral, opposite-sided fibers to the motor nerves of the face will be damaged, and yet only on the lower half of the face.
Yes, sir. What's the reason for this, sir?
Okay, the reason is very simple. The facial nerve nucleus is very different from other nuclei. It has two parts, an upper part and a lower part. The lower part receives fibers only from the contralateral side of the brain, while the upper part receives fibers not only from the opposite side but also from the ipsilateral or the same side of the brain. That's why the upper half of the face is spared.
Yes, sir. So what are the other effects that can be observed in facial nerve palsy?
Okay, in facial nerve palsy, if there is a lower motor neuron lesion, we can see other effects as well. For example, there are three branches of the facial nerve which are emerging from the facial nerve in the facial canal. First of all, the greater petrosal nerve, if it is damaged, it gives supply to the pterygopalatine ganglion, which gives parasympathetic fibers to the lacrimal gland. The patient will have decreased lacrimation or absence of lacrimation on that side. And if the other branch, which is the chorda tympani, if it is damaged, the patient will have decreased or absent taste sensations from the anterior two-thirds of the tongue, as well as no parasympathetic supply to the submandibular and sublingual salivary glands. And the third thing, there is also a branch known as nerve to stapedius, which is supplying the stapedius muscle of the middle ear. If this is paralyzed, the person will get hyperacusis as well.
Right, sir. Thank you, sir.
Okay.